Imaging tech Patty Novak has literally given thousands of mammograms during her career. She's here to talk about what patients can expect during and after their test and why it's so important to stay current on mammography screening. One-on-One with Regional One Health is your inside look at how we're building healthier tomorrows for our patients and our community. Join us as we get to know some of the individuals who help provide life-saving, life-changing care for our community. I'm Amanda Wild, and my guest is Patty Novak, a mammography imaging tech who sees patients at Regional One Health's East Campus. Patty, it's great to have you here. Thanks for coming.
Thank you.
Tell us a little bit about yourself and what inspired you to become an imaging tech and to specialize in mammography particularly.
Well, I graduated back in 1987. I'm from Maryland, and I've been a tech for 36 years. And I started specializing in mammography probably like right away because a lot of people don't really like mammograms. So I figured, let me just try it. And I liked it. And, you have to like your job, and people can recognize it right away that you like your job. So they feel more comfortable with you.
Yeah, I mean, a lot of people don't like mammograms. Can you tell us what you tell patients who might be nervous or scared about having one?
Well, most of the time when patients do come in and it's their first time, they are scared to death. So the first thing I usually tell them is like, whatever you heard, just forget it. It's nothing like what people say. And I tell them that a couple seconds of discomfort is better than a whole lifetime. And then I explain the procedure to them, how I do it. And then every time when they leave, I swear, 100%, everybody's like, oh my God, that did not hurt at all. They walk away with a smile and they're so happy.
Well, is that because of some of the changes you've seen in imaging in your past 36 years?
Yes, because before it was really up to the technologist to determine the compression that we use. But now there's a machine that actually determines it all, and it's so much nicer. The paddles are so much nicer, and the mammogram's never supposed to hurt. And if it hurts you, you need to tell the technologist and they need to reposition you or something, but it's never supposed to hurt you.
Okay, so walk us through the process. What happens when a patient has the test at East Campus Imaging Center?
Well, first they come in and they're the front desk. They get checked in and they get walked back to an all-female waiting room. And we give them these capes and they have to take everything from the waist up off. And they put the cape on. And they also have to make sure they don't have any deodorant on because deodorant makes it look like there's artifacts on your breast. So you never want that. You want to have a nice clean area when we take the mammogram. And then I go and get them and they come in the room and literally it's really only 5 minutes for a mammogram. I usually bring them in and I explain to them we take 4 pictures. We take 2 front views and 2 side views. And I explained to them if I was going to x-ray their hand, because their hand has bones in it, you obviously don't have to compress it. But because the breast is just fatty tissue, so we have to compress it just enough. And then we take the picture. And as soon as I take the picture, the compression releases right away. It's all automatic.
Wow. Well, 5 minutes, that's not how I remember mammograms, but I think that also was always dependent on the tech and how good the tech was. So now you have to be good at using the machinery.
I'll talk to the patient while I'm doing it, like getting their history to make them feel more comfortable. I'll ask them if they have a family history or if they're there because they have a reason, like do they have pain or lumps, if they've ever had any type of breast surgery like biopsies, if you have implants or anything. So I always try to talk to the patient while I'm doing the procedure too.
And you see that whole spectrum of things, don't you?
Yes, we see everything.
This is something I've always wondered from my mammography techs, which is, are you able to see if something is not right? And I assume you would not be at liberty to reveal it if you could. So I've just always been curious.
So usually if I'm doing a screening mammogram, I explain to the patient, the radiologist will look at the films later, and hopefully they have a prior mammogram. If they do, the radiologist will compare them. And then if everything looks normal, they'll get what they call a lay letter sent home to them to let them know everything was okay. And their doctor will get the report, of course. But if they do decide there's something that they want to look at further, they would call them back. And that's considered what they call a diagnostic mammogram. And that day, when they do get called back, the radiologist is here who specializes in mammography, and they will explain everything to them. We do maybe some pictures. I do a breast ultrasound, and we always let the patient know what's going on that day.
That is great information about the follow-up when there's something of concern. What are the guidelines for having a mammogram?
Well, you have to be age 40, and that's for a screening mammogram if you have no problems at all. But of course, there are some people that might have a family history, or if they have pain, lumps, or anything, maybe like nipple discharge or anything going on, then they would have to see their doctor and they would have to get an order, and that's considered a diagnostic mammogram. But if everything is okay, they would start at age 40.
And then how frequently should we get them done, and why is that important?
Well, you're supposed to get them done every year because, of course, your body changes, especially your breasts. And it's always up to you and your doctor. Your doctor knows more of the history, and they would be the ones to recommend more. But it is every year you're supposed to have a mammogram.
Well, you do such a difficult job, but you said you chose it because a lot of people don't like to do it. A lot of people on both sides, right? But you obviously are a special person who does put people at ease during the mammogram, is able to explain the process and do it well. Patty, what is most rewarding for you in the work that you do?
Well, just to have ladies come in here. And I also do male mammograms too, but they're usually diagnostics because they might have a problem or something. But just to help people, that's what matters the most. Even if they don't have a problem or do have a problem, I always want to make sure that they feel at ease. Because believe me, nobody wants to have a mammogram. I don't even want to have my mammogram, but I definitely get mine done every year too.
And then do you walk out saying it was painless?
Yeah, of course. I mean, I have real sensitive skin, so sometimes my skin is red, but it always goes away right away. But it's fine. Yeah, I don't have any problems.
And you do what you have to do. So you're leading by example.
Yeah, and I also have a family history. So if you have a family history, you always want to make sure that you follow that up.
Absolutely. And they're finding more of that. There's more information on that all the time.
Yes, and younger women are getting breast cancer. It's amazing. I'm seeing all ages right now. People come in that have lumps and they're in their 20s and 30s.
Well, I really do think that speaks well to why we have to follow up yearly with our exams. Thank you again, Patty, for great insights and for the great work you do.
Oh, thank you.
That was Patty Novak, mammographer at Regional One Health. Learn more or make a mammogram appointment by calling 901-545-7222. You can also walk in for a screening mammogram. The East Campus is located at 6555 Quince Road. Join us next time as we introduce you to another member of the Regional One Health family. You can check out past episodes at regional1health.org/podcasts. I'm Amanda Wild. Thanks for making One-on-One with Regional One Health part of your journey to better health.